Have you ever noticed those bulging, twisted veins on someone's legs? Or maybe you have them yourself? Varicose veins are common and can cause discomfort. But what makes these veins appear? Are varicose veins just a cosmetic problem, or is there more to them? Can they be prevented, or do they come with age? What changes can help keep our veins healthy? We'll answer all these questions, so make sure to watch until the end. Let's dive in. Varicose veins affect millions of people worldwide. Varicose veins aren't just about looks, they can signal other health problems. They are enlarged, swollen veins that often appear dark purple or blue and are most commonly found in the legs. Varicose veins occur when the veins become enlarged, dilated, and overfilled with blood. They often look swollen and raised, and they have a bluish purple or red color. This happens because of a problem with the valves in the veins. Normally, these valves keep blood flowing smoothly in one direction, back to your heart. But when they become weak or damaged, blood can flow backward and pool in the vein, causing it to stretch and twist. Common symptoms of varicose veins include aching pain, discomfort, and a heavy feeling in the legs. Some people also experience swelling, throbbing, muscle cramping, and itching around the affected veins. In more severe cases, varicose veins can lead to more serious health problems, like skin ulcers and blood clots. Varicose veins most commonly affect the legs and feet. This is because standing and walking upright increase the pressure in the veins of your lower body. Any vein in the body can become varicose, but the veins in the legs are the most susceptible due to the high pressure from standing and walking. Varicose veins are not just a sign of aging, they can affect anyone, and they often run in families. In the next section, we'll dive into the specific causes of varicose veins. We'll look at factors like genetics, age, lifestyle, and more. Before we jump to the next point, to keep this channel going, please hit the subscribe button. It truly makes a difference. Thank you. One of the strongest factors is genetics. If your parents or grandparents had varicose veins, there's a higher chance you might develop them too. This is because the structure of your veins and the strength of your vein walls can be inherited. Weak vein walls and faulty valves can run in families, making some people more prone to varicose veins. As we age, our veins lose elasticity and the valves inside them may not function as well. This means that blood can flow backward and pool in the veins, leading to varicose veins. Aging also makes the veins more prone to stretching and becoming twisted, which can worsen the appearance and symptoms of varicose veins. Prolonged standing or sitting. People who spend long periods standing or sitting are at a higher risk for varicose veins. Standing for long periods increases pressure in the veins of the lower legs, and sitting for long periods, especially with crossed legs, can impede blood flow. Both conditions make it harder for blood to travel back to the heart, leading to pooling and increased pressure in the veins. Hormonal changes. Hormonal changes can also contribute to the development of varicose veins. This is particularly common in women, especially during pregnancy, menopause, or while taking birth control pills or hormone replacement therapy. Hormones can relax the walls of the veins, making the valves more prone to leakage. Obesity. Carrying extra weight puts additional pressure on the veins, especially in the legs. This pressure can damage the valves and make it harder for blood to flow upward against gravity. Over time, this increased pressure can lead to varicose veins. Pregnancy. Pregnancy increases the volume of blood in the body but decreases the flow of blood from the legs to the pelvis. This change supports the growing fetus but can also enlarge the veins in the legs. Hormonal changes during pregnancy can also play a role in relaxing the vein walls. Varicose veins caused by pregnancy often improve without medical treatment within 3 to 12 months after delivery. Injury or trauma. Injury or trauma to the leg can damage the veins and valves, increasing the risk of varicose veins. Surgery or previous blood clots in the veins can also affect blood flow and lead to varicose veins. Other risk factors. Certain lifestyle factors and habits can also contribute to varicose veins. These include smoking, which damages blood vessels and reduces blood flow, and a sedentary lifestyle, which reduces muscle activity that helps push blood through the veins. Wearing tight clothing, especially around the waist, legs, or groin, can also restrict blood flow and increase the risk of varicose veins. For example, maintaining a healthy weight, staying active, avoiding long periods of standing or sitting, and wearing loose clothing can all help. To understand varicose veins, we first need to understand how veins work. Veins are blood vessels that carry blood from various parts of the body back to the heart. Inside the veins, there are small valves that open to let blood flow towards the heart and close to prevent it from flowing backward. Varicose veins develop when these valves become weak or damaged. When the valves don't function properly, blood can flow backward and pool in the vein. This pooling increases pressure inside the vein, causing it to stretch and enlarge. Over time, the vein walls become weak, and the veins appear twisted and bulging on the surface of the skin. Blood pooling and vein stretching. When blood pools in the veins, it can cause them to become varicose. The increased pressure from the pooled blood stretches the vein walls, making them lose their elasticity. This leads to the veins becoming more visible and prominent. The veins also become more prone to twisting and turning due to the increased pressure and weakened walls. Impact of gravity. Gravity plays a significant role in the development of varicose veins, especially in the legs. When you stand or sit for long periods, gravity makes it harder for blood to flow back to the heart. This increased pressure in the veins of the lower body can contribute to valve failure and blood pooling, leading to varicose veins. Role of muscle contractions. Muscle contractions in the legs help push blood back towards the heart. When you move your legs, the muscles contract and squeeze the veins, helping to move the blood upward. Lack of movement or prolonged periods of inactivity can reduce these muscle contractions, making it harder for blood to flow and increasing the risk of varicose veins. Now that we understand how varicose veins develop, let's discuss how to prevent and treat them. Stay active. Regular exercise improves blood circulation in your legs. Activities like walking, swimming, and cycling help move blood back to your heart and reduce the pressure in your veins. Maintain a healthy weight. Extra weight puts more pressure on your veins. By maintaining a healthy weight, you can reduce this pressure and the risk of developing varicose veins. Avoid prolonged standing or sitting. If your job requires long periods of standing or sitting, try to take breaks to move around. Flexing your legs and changing positions can help improve blood flow. Elevate your legs. When resting, elevate your legs above the level of your heart to reduce pressure and improve circulation. Wear compression stockings. These specially designed stockings provide gentle pressure to keep blood moving and reduce swelling in the legs. Medical treatments and procedures. Sclerotherapy. This procedure involves injecting a solution into the varicose veins, causing them to scar and close. Over time, the treated veins fade. Laser treatments. Laser therapy uses light energy to heat and close off small varicose veins and spider veins. This treatment is effective for smaller veins and doesn't involve incisions. Endovenous ablation therapy. This minimally invasive procedure uses radiofrequency or laser energy to seal off larger varicose veins. A small catheter is inserted into the vein, and heat is applied to close it off. Vein stripping and ligation. In this surgical procedure, the affected vein is tied off and removed through small incisions. This is usually done for larger veins. Ambulatory phlebectomy. This procedure involves removing smaller varicose veins through tiny punctures in the skin. It's done on an outpatient basis and involves minimal recovery time. When to see a doctor? If you experience severe pain, swelling, or skin ulcers near the varicose veins, it's important to seek medical advice. These could be signs of more serious conditions like blood clots or chronic venous insufficiency. A doctor can recommend the best course of treatment based on the severity of your condition. By combining lifestyle changes with appropriate medical treatments, you can effectively manage varicose veins. Prevention is always better than cure, so taking proactive steps to maintain healthy veins is crucial. If you experience severe symptoms, it's important to consult a doctor for appropriate treatment. Please check out our next video above. Stay proactive about your health and take steps to keep your veins healthy and strong. See you in the next video.